Quickly, good afternoon, my friends. Does your culture still think that female genital mutilation is the right thing? Today, we are going to discuss about female genital mutilation, and I want us to discuss and compare whether our culture should abolish female genital mutilation or not. Okay, female genital mutilation, while discussing it today, we are going to understand two things. What happens to the person, that's what happens after female genital mutilation has been done on a culture. And another thing, how is female genital mutilation practiced? How is it done on a culture? Understand? So after discussing about this, we are now going to know if female genital mutilation is the right thing according to our culture or if it should be abolished. Firstly, we are going to discuss now what are the types of female genital mutilation. That's how is it done. Female genital mutilation have three types and other procedures too. But the main three types of female genital mutilation are the clitoridectomy, that is where the skin that sits on the vagina is being removed. They remove it and leaving that part there. That is the first skin, the first upper skin on the clitoris. That is removal of it is called clitoridectomy. The second method is the excision. When we talk of the excision, we mean the removal of the clitoris itself. It could be partial removal or complete removal of the clitoris itself. It is called excision. So there won't be any part, any hood, skin, around there anymore. That's lip part that closes and open will no longer be there. It will be removed. You understand? It's either partial or impartial, incomplete removal of it, complete or incomplete removal of it. That's what we know as excision. The third type is what is called the infibulation. The infibulation is the removal. It's the skin around the clitoris totally removed. Both the clitoris lip itself is removed and then just have the opening. And after then the opening is stitched and a little opening is just allowed to remain. No, our most cultures will say that it will make the culture not to be a kind of promiscuous when it comes to sexual intercourse. No, but now there are other methods too. Like the scraping of the skin around the clitoris and the vagina, the piercing, method, and a lot more other methods that are harmful to the vagina. Now, we have talked about how it is done. This is just how it is done. These methods are how they carry out female genital mutilation. If you don't know now. Now, there is another thing I talked about that we're going to discuss. That is the effect, the implication. What happens to the person after the act has been done. Now, most mothers, after carrying the baby in the womb for 9 months and delivering the child, they take the child to a traditionalist or where they will actually carry out this female genital mutilation on the baby, and at the end the baby will not survive it, the baby will die. So that is the number one effect, death. So the child would die because the child cannot withstand the pain and the bleeding that comes with That's art. Another thing is bleeding, severe bleeding. The baby will bleed so badly. Another thing we are going to talk about is the pain. The pain is so painful, very painful. And you know, anesthetic is not given. Pain relief is not given. They just do it and ask you to carry your baby and go. And most girl child that undergo this at a later age, 15 years old or below, they are subjected to more pain because the baby girl, the baby child might not cry much or feel much pain because they are not. But at this later age, they are old. They feel more pain and understand pain more. So it's going to be very painful for them. You can imagine. There are long-term implications as well, which are the person who has undergone this female genital mutilation may experience infertility. They may experience infertility. Another thing is this: they might be exposed to infections, a lot of infections, urinary tract infections, and what have you. Another thing is that girl child that is exposed to this may have difficulty in childbirth because their opening, the vaginal opening, has been sealed partially, leaving only a little opening. And so that little opening needs to be wide because for it to be able to accommodate the baby that is about to come out. So because of that, most of them, instead of putting the baby under so much pressure because the opening is too small, they will undergo CS. Or some of them will have to receive tear, and it's a very bad tear, 3rd degree tear. Understand? You also have to pass through the pain of stitching it after delivery. If you are a mother here, you can feel it. So I'm also trying to tell us again that and other implications of female genital mutilations are inability to urinate smoothly. What I mean is this: the passage of the urinary flow will be blocked, and when it's blocked, the woman or the girl child cannot pass out urine freely. You understand? And most times it will become a health issue and they'll be taken to the hospital and the doctor will be forced to also carry out other surgeries on the child in order to let out more openings so that the girl child can urinate freely and menstruate freely, because most times it also causes blockage of menstrual flow. Also, of what use is it if after carrying out this female genital mutilation on your child is being exposed to all these health implications? Of what use is it? So we are talking about the long-term implications. Some other girls will develop abscesses and cysts. These abscesses and cysts will block the urinary flow passage, making it difficult for them to urinate freely, pass out menstrual blood freely, have intercourse without pain, and other things. So you see, the bad effect outweighs whatever good reasons your cultural belief have told you. It outweighs it. So today I urge us, let us put a stop to female genital mutilation. Let us put a stop Advocate around you if you are practicing it currently. If you are doing this on your kids currently. If you are treating your kids so inhumanly currently on this, please stop it. Please stop it. It's not going to help them. And tell your friends who are into it to stop it, because you are not helping the girl child. Let us put a stop to female genital mutilation today. Thank you.